Right, so let's have a look at this next case. So this is a, well, it looks like facial bones. No, so it's a mandible maybe. So let's just wait for this to come through. So I think I'm coming down with something. Feeling a bit shivery today. Maybe it's just cold, I don't know. I've heard Sweden's very cold at the moment. My cousin who's in Sweden keeps telling me that he walked out his house and there was his hair froze, which I didn't know could happen, but apparently it can. Right, so let's have a look. So obviously, yeah, as usual, just let me know what you think. Cold in Denmark, is it? How cold? How cold is it cold? How cold is cold? Because for me, -1 is cold. Oh, okay. Yeah, -6 is cold. I'll give that to you. Yeah, we're not -6, I think, at the moment. We're like -1 or something, -2. But yeah, okay, so let's have a look at this. Yeah, Edinburgh's always gonna be cold. Yeah, it's true. I don't know how you guys do it. I just don't. I don't know. I want to move something hot one day. I don't know if that's going to happen though. All right, let's have a look. So let's have a look at mandible. So it looks like -4 in Leeds. What's going on in this country? Are those normal figures to get? So is this sort of Arctic thing that's happening right now? Okay, so let's go for yeah. So someone's come out with this. So again, you know what? I'm going to try and show you guys. So let's do oblique, mystique oblique, whatever that's called. Let's MIP a bit and let's window a bit to try and make it look more like skull. Let's see what's going on. So, and then what we'll do, we'll just try and line things up a bit. So I genuinely think this is a really good way to spot fractures. And look, can you see it looks like, I'm like Macbeth. I'm holding that skull in my hand. And can you see that straight away? Yeah, there is this linear abnormality located there, right in that sort of middle aspect of the mandible, right? So then you think to yourself, okay, well, that's one fracture, but you have to remember that a mandible is a bit like a polo ring. So if you're going to have a fracture, you're going to get fracture in two places, not one place. So then you've got to start looking for a second fracture. Where could the second fracture be? So I haven't seen a second fracture on this view. So we may need to go here, maybe window a little bit more, have a look. Can you see that? Just there, the fracture going down that way, down that way, down that way. I don't know if anyone's convinced by my method of doing it, but I definitely find it very, very useful. But look, the other side, no fracture. Come back to this side, there's definitely fracture. And if we just reset everything the way it is, meningioma, let's have a look actually. You see that? Meningioma frontal lobe. Someone feels as though they saw a meningioma. This one here, yes, it could be. It could be. So yeah, you could get a calcified meningioma, very, very commonplace. It does look like it's extra axial, and there's probably going to be a bit of CSF space between this and that, so it's more likely to be one. Would I be worried about it? Not really. It's probably not causing enough mass effect to be causing any major issues. And yeah, I think the main problem with this person is that they've got these mandibular fractures. And if we look on this view, you can see it there. And then if we go NPR and go sagittal, you'll be able to see it coming up there. So quite a significant fracture going all the way along there. So this person was punched, right? So then let's have a look. So they were axial. Then looks like they got punched on the right side. Where was that fracture on the? No, it's left. Yeah. So you know that common thing that they say, like if you're gonna sustain injury getting punches, usually with the left side, because the person punching you is going to be. Oh yeah, you know the 3D. So I'll come back to the 3D recon thing because I've done exactly the same thing. So yeah, normally it's going to be the left side of the face that get injured because most people are going to punch you are going to be right-handed. Yeah, so the 3D reconstruction, you are right, but I have found on the occasion you do miss subtle ones because it does this tendency of like slightly smoothing over. So if it's like a really small fracture, it does slightly smooth it over, and it does a weird coloration thing where, well, the ones I've done, and you may want to correct me, but the 3D reconstructions that I've seen, they kind of make it look as weird creamy color, and it's actually just easier to have a black and white. And I found that over the years that doing that MIP method has been a really good way to make sure that I don't miss the fractures too much. Right, cool. But anyway, yeah, if it works for you, it works for you. It's just a different method, and sometimes it may be worth trying all and seeing what works.